brief and succinct. There has been some recent, within the past several years, literature out there that suggests and documents that if you prep the vagina for a C-section, that when the cervix is opened from the uterine side, you have less chance of bringing bacteria into the uterus and then having infections, etc., both at the uterus level or even up at the skin as it comes out. So we will go over prepping of the vagina today. So first, proper hand hygiene, etc. Check the patient's allergies, make sure they're not allergic to betadine. And the new change is we'll be adding betadine scrub to the mix, which is betadine, a little bit stronger than betadine paint. Betadine 10% with detergent in it. So it will suds up quite a bit. So what we've been asking you to discard, now asking to use. But it still is not used in the vagina. It's used around the vagina. Okay, so open up your prep kit. And this is a used prep kit from the past, so apologizing how it looks. We're looking for you to touch the outer 1 inch of the drape. That way we maintain as large of a sterile field as possible. And for proper orientation, I should extend this down a little bit. There you go. Trash cans over there. I've washed my hands, we're open. And the first thing that I'll pull out here is a pair of sterile gloves. And open this up. Real quick on the gloves, if you take this little flap here at the bottom and you invert that 180 degrees, it'll keep this thing from flapping back closed onto you. So now you have a sterile area that will stay open. Your gloves are cuffed, so if you grab the glove, you can grab all the way down about almost 2 inches. You have almost about 2 inches of grasp there where you're still going to be on the part that's touching your skin. Place your hand in the glove. It's like that movie Dr. Detroit, if you remember that movie. No? Okay. It's in the 80s. And then your other one, you tuck your fingers under the glove, in the cuff, pull that up. All right, within your, you have a lady, you have her legs frog leg, you have to be at her bedside. From a protective standpoint, you can't have a safety strap on at this point, it doesn't work. You'll typically have your fetal heart tone machine on, taking and listen. And you come with 2 drapes that are within this. These kits are essentially set up in a standard fashion for abdominal draping, which is why you get 2 of these, one on each side. But for vaginal draping, you only need 1. Give yourself about a 4 to a 6 inch cuff that you're going to place on the edge of that. And then sneaking in from the side with the leg up in your chest area, you come in, and with your hands protected, you scoot this under here. Betadine can be caustic to the skin, and so this is in an attempt to prevent pooling from occurring underneath the patient, keeping their hands sterile. These towels will be used to dry the betadine, or to wipe away and dry the betadine scrub away. This is different than what you've done in the past. These were discarded. In your prep kit here, you have 3 sponges in 1 large bag, and then 3 sponges in another bag, and then 3 brushes. So you have both betadine scrub, which is the brown one. It makes millions of microscopic bubbles that last for hours. And then you have betadine paint. It also makes bubbles, but they're smaller and they go down a lot quicker. It says right on it. This one's labeled solution. That's the paint. And then the scrub is the detergent one. What we're going to add on the scrub. Anyway, in an attempt to make the mannequin a little bit easier to clean when we're all done, I'll be simulating with this. Please do not think because it's red, that means HIPAA cleanse. Right, so we're using betadine scrub, betadine paint. So 3 sponges in one side, 3 sponges and 3 brushes on the other. This is simulating in betadine scrub going on these brushes, or these brush sponges, and then opening the other bottle of paint, put it on these 3 sponges and your paint brushes. Okay, and then that can go in the trash. Okay, at this point here, we're going to take the first sponge. Sponges are what we call dog-eared, and so if you look, it's slit halfway down. That allows you to reach your hand in and have a purchase to grab it without touching the patient, right? So my right hand is being protected by those underlying flaps. So you grab it by the dog ears, moisten it, squeeze a little bit off so you don't have too much on. And then our prepping region will be, if you could just to the side there. Quite all right. You can make noises. It adds to the effect. Yeah, it makes it a live performance. No, it's quite all right. So mons pubis, and then we're going to be covering this zone down. The object of this in a detergent is to exfoliate the skin, is really what we're doing. And so we're not looking for you to target to get anything intravaginal. I'm just going to rub it across. Okay? So again, this is scrub, not paint. So we're scrubbing with this. So as you apply it, you scrub, and you'll be like, just make your way down. And you can't come back up. Once you go down, you don't go from a potentially dirty area back to a clean area. You make your way down, across the rectum, anus, and then trash. That's sponge number 1. Sponge number 2, starting at the outside of the labia major, on either of the leg, whichever one you want to work on. Not getting towards the vagina. Work your way up and down, scrubbing. About a third of the way up the thigh. I'm just trying to make a zone that the surgeon, a zone of cleanliness. Okay, and then that's sponge number 2. Third sponge, grab the dog ears, dip, get rid of the excess if there is any. And then you don't want to place your hand over the sterile area that you're trying to make if you can help it. And you grab here, and you're working off of the opposite side against the labia major and working your way up the thigh, about a third of the way up the thigh. Okay? So that takes care of the application of the scrub, the scrubbing motion. Take one of the blue towels. These are absorbent towels. They're not. These are water absorbent, repellent. So it'll hold the water but won't let it leak through. This here will allow the moisture to go through. It's very absorbent. And this is protecting your hands again. This is laid down between the legs and on. At this point, you still haven't contaminated your hands. You haven't touched anything yet. Different than paint. And with both of your hands, you can go in and dry everything. So now what you're trying to do is remove all of that detergent that's an irritant to the skin and to the vagina, if there's any there, and you're trying to remove. Once all that's removed, this is about the trickiest portion of this part. You can't contaminate your hands by the edge. So if I were to grab here, I'm contaminated. Consider contaminated. I have to change the glass out. So you grab about 4 inches in. I do it with my index and middle finger. I grab, and I roll my hands in, and then out. And what's touching me is the clean part of the towel, not the dirty part of the towel. That will come off into the trash. Okay. So now this part we've completed the scrubbing part. Now we're going to the painting part. Paint is an application. This is the part that provides a level of sterility. We start the same fashion with the sponges. So you dog ear your first one, and you have paint applied. You're not grabbing the scrub, you're grabbing the paint now on your sponge. And your first one is covering the same area. And you may want to get into the habit of this. No, this is an application of paint. So as you paint down, down to the anus, and you're done. That's number 1. You've just done this zone. Okay. And then the next sponge, the same process as doing to the left and right side of the labia major and up 1/3 of the thigh as we did for scrub. So the practice is the same, but you're just applying paint, not scrubbing scrub. It's 1/3, trash, grab the next one. Now if anyone's looking at the clock, wondering how long this is going to take, you probably will do this on an emergency C-section. Okay? And then the same deal here. Up about 1/3 of the way. Deal. I haven't missed yet. Yesterday was not good. Okay, today, now you go to the brush application. The brush is going to be going into the vagina. Make sure you get the foam thing when it comes back out. Right? So you'll go in, and this is the one time that you want this thing soaking wet with betadine. So generous, it's in your instructions there as well, which is basically, most of it's cut and pasted right out of Mosby's for you. So you can get a refresher. There's a video online as well. Wet your brush pretty well with betadine paint. And then this is where you can commit a hand if you need to. If you can't get into the folds and you need to separate them, utilize your hand. So you're committing this hand. This hand is now considered, it's clean, but it's now considered your dirty hand. It's no longer your sterile hand. And you can go in and separate the folds, clean, and then you're going to go in, and as you're doing this, almost all that betadine is going to be washing off. It's in its own cleansing process. It's running down with this towel collecting. You go in, and then if you can imagine the quadrants in there, if you're just a big circle or the inside of a dome, and you're just going in there and going up into that region, over to that region, over here, over here, over here. We call it scrambling the eggs downstairs to help get the thought process out. And then on your way out, do not come up, because you'll contaminate the urethra. You come down on your way out, and credit card swipe down towards the anus, and then this is trash. Can I go like this? Not with this hand. This hand is now committed. I can take this hand off, but now I can't put it back. So you're kind of stuck with where your hand is. Saying your neck sponge doesn't have to be as wet. I pretty much dip the tip, and then there's a little cross membrane here. You can get rid of some of the excess. Your first one needs to be wet. Your second one doesn't need to be as wet. Same deal. This goes in, on its way out, down, not up. If you want to wear safety goggles, which is never a bad idea if you're in an operating room because of the flicking aspect of this on the way out. Now, if the baby's at +2 station, you're not going to get much of a brush in there. You're trying to do the best you can. And then your last brush, you can wet it, but really you should, when you're done, go back and actually literally dry most of it back off. This is what's going to get rid of the excess betadine that's in the vagina that you don't want to leave pooled in there, because a woman can absorb all of that and have some type of minor crisis from iodine absorption. Never seen it. It's in the literature. Never seen or heard of a case in anyone I've ever worked with, but it is in the literature. This last one goes in, similar pattern, in, going around, swipe on your way out, you're done. At this point, your prepping portion is essentially complete. They're about as sterile as you're going to get. At this point, if there is not a Foley in, you've prepped for a Foley, ready to go with Foley. I'll use my dirty hand. Okay, so I wouldn't do that. You could ask for a Foley, or if you've already pulled one out and have it aside, now would be the time to insert your Foley. While the leg is still in that position, you can take the Foley, throw it under the leg, pass it under the leg, and out. So you're not readjusting that later. So when you know that you're done manipulating the area down here, you take your hand out, and then you grab this straight. You don't have to worry about what you're touching. You take this to get them out of the betadine that you put them in, remove that, and that goes in the trash. And then all of this stuff is discarded. Lights go down, secure the Foley to the patient, and then bring a sheet up over the legs, safety strap. Now you can apply a bogey pad. You don't apply a bogey pad and then manipulate the legs, because the pad will loosen up. The machine protects you against that error if something goes wrong. You apply the bogey pad after. Once that's done, now you go to your abdominal prep. And we use the floor prep here. Questions? Yes?
Probably already answered this before I came in, but what do you use if your patient's allergic to shellfish or iodine?
Fantastic. So shellfish is a misnomer.
Okay.
People with shellfish allergies don't have betadine allergies. The doctor can have a candid conversation with the patient. What do you mean by an iodine allergy? It's the classic, I have an allergy to epinephrine. It makes my heart race. Right? Not an allergy. So you have to ask, what do you mean by an allergy? If there is a true allergy that the provider is concerned about, there are 3 common alternate prep agents that are out there. Saline, because really all you're doing here is getting rid of some muck. It's really all we've done. We haven't really sterilized anything. We've made a good attempt at it. Saline, Johnson & Johnson baby shampoo. Why does the OB/GYN community insist on saying that's an alternative prepping agent? Because it's sitting on your unit. It's the same reason you use formula to test the bladder to see if it's leaking, because the only sterile fluid you have that's not clear is formula. It's probably not that big of a deal to use one way or the other. And then finally, in a few years from now, you will probably see chlorhexidine gluconate coming out on the market as approved. They use it outside of the states, like in Sweden and places like that, but it's not used here. Again, you're working under the direction of the provider. If the provider says, I want you to use chlorhexidine gluconate, please use your team steps approach. Right? I have a concern. I think this is unsafe, or I'm uncomfortable doing this, and there's a safety concern. The product says not to use it, but if you want me to use it, I can. Good question. That almost always comes up. Anything else?
So we're doing vaginal preps on
Yes, ma'am. So you're
on all C-sections, including schedule?
yeah, the current practice, which we've gone over, is a vaginal prep on all C-sections, unless the urgency is so great, so fast to go, there's no time for it.
So I'm just wondering, like on scheduled sections where there really isn't muck going on down there, it's just normal vaginal flora, do we really need to do? And how
Yes.
much are we lowering the percentage of infections?
Yes.
I only asked that
Continue to
because
do
in
it.
my old place, we never did it.
Yeah.
And
No,
I think
it's-
in most civilians,
Sure.
we don't.
It's
Is it
come from
in
the
there?
database, so I looked it up since I didn't believe it.
Yeah, in 2015, in January 2015, they started coming out with the first documentation.
I know.
I don't know what the percentages are. It's not wrong. It's just like the Joint Commission manual. You can't find fault with anything in it. It's just how are we gonna do that and maintain the business model? Yep. Yes, so the answer would be every single C-section should have this done. Some of them you may have to omit because of time, because of the speed at which you have to get the baby out.
Okay.
You have a hard time getting the sponge in there on some ladies.
Yeah, but you know, I'm just thinking like on people that are scheduled sections, right, that have not had like all kinds of manipulation and stuff introduced into the vagina. We're doing all that
But
and we're
there's-
just putting in a Foley.
But there's still normal, so
I
the,
know I'm thinking old school, but I'm just trying
so
to figure it out.
the prepping is not for the Foley as much as for
Right,
cleaning the cervix, so that when the os is opened, to allow for bleeding at the end of the case and expulsion of whatever remnants are there, that you're not introducing bacteria back up into the uterus.
okay.
We covered that at the beginning.
But the os is not really open, right? If
At the end of the
you have
case, the
somebody,
os
let's say if
is,
you
at the end
have,
of the case, the os is open, and that's.
through vaginal manipulation, yes?
Intraoperatively, they take a ring forceps, poke it open.
I'd be worried if it was a face presentation, baby might aspirate some of that stuff.
Betadine is safe to use all over the body. If you have a gunshot wound and your belly's hanging out, use betadine.
No, I'm talking about the baby, if it's in a face presentation,
I know.
the baby
Yep.
could aspirate.
It's a great point if you want to bring that up with your provider. I see the mouth there. Should I prep the mouth? No, I mean it. I mean, as nurses, we're working under the doc's license. I understand what you want me to do, and I can prep there. I have a concern that I probably shouldn't prep by the mouth. Oh, good idea, don't prep the mouth. Yep, it's a good concern. That's a visualization I don't want to have. Sorry. But it's a good point. We use chlorhexidine in the mouth. We use betadine in the mouth when we prep patients for different types of surgery. And we accept the fact it's dirty. It's like the vagina, it's dirty. Not to be rude,
Right.
you know, as far as sterility issues. Good question. Any other questions? Now, if you're timid to ask a question in front of the group, I'll stay late. If you want to go over and practice, we'll get the sponges back out and you can re-practice. This is not HIPAA for those that came in late. This is simulating betadine paint and betadine scrub. It's just messy for the manicure. Okay?
Thank you.
Awesome.